commonly said that data is the raw material in the digital age. If that's true, then data fluency is a critical enabler. It's unlocking the power of that raw material data.
With the mergers and acquisitions in Jefferson Health, there's lots of disparate systems that are coming together. So you have emergency department systems, clinical EMR systems, patient registration systems, and the need to gain insights across now our Jefferson enterprise is really increasing the need and demand for data. So how do you register a patient into the system? How do you treat them in the ICU or on a particular patient floor? How do you manage them when they're in the operating room? All those different touch points at different systems. We needed a solution to drive analytics across the enterprise. Epic is an electronic medical record. We wanted to be bold and be different and implemented Epic along with ClickSense as our primary analytics tool with our Go Live. That deploying Click along with that EMR implementation together was the first time that anyone was really doing that.
Click has been a key tool for us in addressing our data challenges, making information accessible to users, accessible in very powerful, interactive data visualization tools that allow people to develop a relationship with the data and start to probe and answer the questions that they have. We are increasingly seeing feedback that Click tools are being used in meetings to answer questions in real time, and hearing that questions that used to take a few weeks to get an answer to are now being answered directly in those meetings. So it's very, very powerful change in the access to the information.
We have around 90 ClickSense applications focused on Epic healthcare data. We are now starting to also get into more of the enterprise as a whole to ensure that we're measuring things across all of our 4 divisions.
With Click, they have visualizations and multiple tables within one sheet that can tell them the whole story without having to run multiple reports.
It's been a great experience learning Click. I think it's a great tool for providing insights to the organization and ultimately reducing costs, but also improving the patient experience.
I come from a clinical background, and I think there are many ways that that data becomes helpful in this setting. So you can say, hey, yeah, I dealt with this family that dealt with this situation, and this is the kind of data they're looking for. And suddenly it becomes more meaningful work that helps to keep everybody a little more motivated, keeping the focus on the patients and their families. The visualizations are so engaging, and the interactivity of Click is so engaging. It really does make insights jump out at you, as opposed to looking at a static spreadsheet.
Epic has this population health module called Healthy Planet, and we're able to develop Click applications off of registries or populations of patients and track the associated quality measures with those populations to help close care gaps. An example has been we have a cancer screening application, and we've seen an increase in closing those care gaps, which should translate to saving lives.
Every data point has a story to tell. We're starting to see people use common language, common dialect within Jefferson around different concepts related to data. We realize that data fluency is still one of our biggest challenges to really unlocking the power of that data in the future.